And welcome, everyone. We've got a very interesting discussion lined up today. As we all know, AI has been a topic of much discussion over the last couple of years, especially in the healthcare environment. And we have moved quickly from discussing Gen AI to Agentic AI in 2025, and a lot of things going on in all fronts, AI focused, as well as, of course, the continuing evolution of the impact on data analytics. So today we have some very experienced thought leaders in the space coming from different perspectives. I think it'll be a very interesting discussion. Let's go ahead and jump right in. I'll do quick intros, and then we can dig into some of the content. First up, let's introduce John Poley. John is industry principal in healthcare at RingCentral. John, tell us a little bit about yourself and your background.
Well, thank you, Greg. Thanks for having me. Yes, so quickly, the industry principal role at RingCentral is primarily a sales strategy and go-to-market role where I define how we take the RingCentral services and platform and develop our strategy to grow and provide services and solutions to the healthcare vertical across all segments and across all continents. I've been with RingCentral about 5 years. Prior to that, spent about 7 years with Gartner as an executive partner, and before that, 5 years as a CIO at Delta Dental. So with RingCentral, we are the largest pure play UCaaS and CCaaS provider in the world. That's unified communications as a service. Think of your entire telephony infrastructure, voice, video, messaging, collaboration tools, digital fax, all of that as part of a UCaaS platform. And CCaaS, which is contact center as a service as well, where you have agents and kind of industrialized call center activity, also provided entirely through the cloud. So we are working on building a next generation platform and telephony infrastructure for the healthcare vertical, and excited to be here to talk about how AI impacts that and how it impacts our clients going forward.
Great, thanks, John. Next up, Dr. Anil Jain. Anil is the Chief Innovation Officer of Provider Digital Transformation at Innovacer. He is a medical doctor. He spent, a long time at the Cleveland Clinic. I won't say how much because I don't want to age you or anything, but where he did a lot of work in innovation as well. But Anil, maybe you can tell us a little bit more about your perspective that you're bringing to this discussion.
Sure, Greg. Thank you. So yes, as Greg mentioned, I'm Anil Jain. I'm the Chief Innovation Officer at Innovacer, and I bring both that clinical lens, but also a health IT lens. I'm an informaticist by background as well. Innovacer is a company that's been focused on data, analytics, AI, and automation for some time now. We made our mark initially in population health, and we're getting more and more involved on the enterprise operations side of healthcare systems. I think what you'll hear from me is a little bit about the importance of data before you have AI, and the importance of really thinking through where is automation and AI intersecting with the workflow optimization that need to happen in healthcare. Joined Innovacer about 4 years ago. Prior to that, I was with IBM Watson, where we focused on AI in the healthcare domain. And prior to that, as Greg mentioned, I spent a very long time at the Cleveland Clinic and spun an analytics company out of the Cleveland Clinic that eventually was bought by IBM that made me an IBMer overnight. So looking forward to the conversation and really getting into a very important topic and a very timely topic.
Great. Last and not least, Nitin Minocha. Nitin is a senior industry analyst in the digital health program at Frost & Sullivan. He leads up a lot of our AI-focused research in the provider payer space and other research programs or topics as well. But specifically, excuse me, for this discussion, he is our lead analyst on AI and healthcare. So Nitin, introduce yourself a little.
Thank you, Greg. Hi, everyone. This is Nitin Minocha. I'm senior industry analyst and have been with the firm for about 2 years now, leading and working mostly on the emerging technology space, especially with focus on conversational AI, agentic AI, and generative AI. So how the trifecta of these three technologies is really enhancing payer, provider, and patient landscape. Prior to joining Frost & Sullivan, I have a background in pharmaceutical and healthcare consulting for about 6-7 years, and looking forward to have an engaging discussion with two of the brightest minds here.
Great, thank you. Well, to start that discussion, let's jump right in. And Nitin, maybe you can do a quick introduction on some of what we've seen in the Frost and Sullivan side in terms of AI models and adoption.
Absolutely. So, as we might have read everywhere, and we have also seen that AI is in a different league when it comes to the healthcare sector. Unlike the previous technologies that were slower to be adopted or took more time to gain that interest or popularity, AI has had a speedier adoption and is more tenacious when it comes to uh, adoption, implementation, as well as looking at newer use cases. The three models that I just mentioned in my intro, the conversational AI, generative AI, and agentic AI, the trifecta of these three is really bringing in the capacity to improve patient or staff engagement or stakeholder engagement at a broader level, enhance the process efficiency, and ultimately provide an intelligent care journey or a care pathway for patient providers as well as payers to have the best of the experience that is possible and that everyone wants to achieve. Very often we say that patient or providers, they don't get the experience that they are used to, and especially outside of the healthcare industry, and that is everyone wants to see that they have that seamless experience, the seamless connectivity. And I think that is where we have seen that AI is bringing in the change and enabling those connections to happen and those efficiencies to happen. Today, healthcare, if not the leader, but it's still ahead of many industries when it comes to adopting newer AI models to improve their process efficiencies and improve turnaround times and enhance care delivery. As per a Frost and Sullivan survey, over 91% of healthcare leaders think of AI as a critical or crucial technology in their transformation journey, and they are actively putting aside investment or funding dollars in their organization to really invest in this strategy or in this technology. The key drivers from what we have seen, and is slightly comparable to even the other industries as well, is that we want to have an enhanced or centralized data-driven decision-making process in place. We want to improve the experience of all the stakeholders that are in the journey, as well as develop new revenue streams and improve the operational efficiencies. So these 3 or 4 are the primary drivers that are really leading the investment into the healthcare AI space. However, challenges still persist. They have been for the past 2 to 3 years since we have started discussing about conversational and generative AI, but they are still there. And the key challenge that really impacts the industry is the lack of the human talent or the skill set. So because of this, there is always a gap in how this technology is being adopted, what internal innovations can take place, and ultimately the reliance on an experienced partner to really guide you through that journey and really help you develop those use cases that are essential for the overall improved engagement. Another challenge that is an important one is in the assessing the return on investment. Some of the AI models like documentation can provide near-term ROI and is beneficial. End user or adopter can see that, yes, we are benefiting from adopting this technology. But the use cases in terms of risk adjustment or enhancing the care pathways or care journey, so these are more of a long-term processes, and their ROIs are also visible over a longer period of time. So that makes it a sort of or creates a hesitancy in the leaderships to really invest in that technology. So how can we address that and really guide the end users in their journey that, yes, ROIs are there, it will take time to come up, but how can those challenges be addressed when a discussion is going on selecting the AI models? Another important challenge that really comes up and has been for now a long time are the ethical and the regulatory aspects. Till now, the regulations are following the AI developments, and it's difficult for them to keep pace with how the innovation is taking place. Every time we see that a newer AI model is being introduced, regulations have to be redefined. There have to be new parameters have to be inserted in the regulations to really address those innovations. So can we reach to a point where regulations can lead the innovation? Maybe, maybe not, but it's an important factor and a challenge that will essentially has to be addressed every time there is a discussion about AI that happens.
Thank you. Great intro. As you mentioned, healthcare for a change in technology adoption is ahead of many of the industries. When we look at our surveys of across 10 different industries and see that healthcare adoption of newer AI models, including agentic AI, is actually on par or ahead of many sectors. And we've seen innovators and early adopters already reaping the benefit of technology in specific use cases. But of course, the majority and the late adopters are now trying to figure out where do they bring AI models into their enterprise strategy. So when we look at how technology is changing, we mentioned Gen AI just 2 years ago. That was all the rage. Now agentic AI, new solutions, processes, capabilities are being added by almost every health IT vendor into their solutions across the ecosystem. What should some of the buyer strategies be to ensure the stability of solutions and access to the latest value-added capabilities? And also, what are some of the learnings that are directly transferable to new adopters? How can they learn from what's already gone on the early adopter group? How can they minimize resistance internally as well to AI implementation? Anil, maybe you can get us started on this discussion.
Yeah, absolutely, Greg. I think that's a really important question. I think the first step in this journey, especially for new entrants, is to create a strategic AI governance committee and at least adopt a framework so that they can actually start to evaluate the various components of needs that they might have, and then who might be supporting those needs out there in the vendor community. Now, these governance committees and these frameworks need to be multidisciplinary. You need to have legal, compliance, you have to have IT, as well as making sure that anyone who's going to be making decisions down the road are included. And there needs to be a strong emphasis on data stewardship. As I mentioned earlier in my introduction, data is key. If you don't have a good data policy, you have no AI policy. And so that's going to be an important piece. The second one for these early or these late entrants to be thinking about is how do you come up with a modular interoperable architecture approach, one that focuses on ecosystem partners and not just point solutions. For example, we at Innovacer just last month released a platform called Gravity to provide some of that acceleration of those who are looking for a platform and not just point solutions. This allows the organizations who are embracing AI to grow with their needs and not have a lot of conflict in the field. Now, once you start to bring in solutions, it doesn't end there. There needs to be continuous evaluation of those processes. And the way I equate it, and I was speaking to a colleague last week about this, just like human beings, we have performance reviews every so often. Maybe it's once a quarter, maybe it's twice a year, maybe it's once a year. We need to be doing the same thing with our AI digital workforce as well. We need to be evaluating their performance. So that's the bit of advice I would have for strategically thinking about bringing different folks, different capabilities on to an organization. And then in terms of what has the early adopters been able to transfer in terms of knowledge over to the late adopters, I think most people that I see running into challenges with AI pilots. And remember, in AI, anywhere between 80 to 95% of pilots fail. Often it's because of change management. They also take on more than they need. Start small is the advice I would give for late entrants, and make sure that you are, if you're going to be co-developing with partners, make sure you have a team that's understanding of what it is that's required of them in terms of the commitment they're making to a development partner. It's not going to happen magically. And then finally, there is a lot of resistance to AI implementation. And much of this, in some cases, is going to be a lot of what I would say hypothetical concerns over real concerns. But there are things that we can do to make sure that we get over the resistance. The first thing that I often speak about, and especially since I'm a clinician, it's all about trust and transparency, especially with healthcare, which is perhaps very quickly adopting these technologies as you saw in your Frost and Sullivan poll and survey. They're also the first to ask questions around trust and transparency because we're talking about human lives, especially when it comes to the clinical front, and even in the back office, we're talking about operational challenges. So I would make sure that the resistance around trust and transparency, around the regulatory challenges, and also the hypothetical fear of being replaced by AI are addressed head on by organizations so that they minimize some of that resistance. Let me pause there and see if that made sense, Greg.
No, that's definitely interesting perspective and valuable insight for people who are just starting down this path. John, you have other perspectives that you can bring in from your experience?
Completely agree with Anil's summary and what recommendations he's made. The two things I'd look at that I think are very interesting as I think through this issue and our challenges. So, when we look at the AI sector, it tends to take two functional roles or general roles. One is the construct of automation, this ability to take human tasks and move that into a digital experience. So we're seeing that across our communications sector, for example, moving scheduling calls to a digital experience, moving integrations and updates and product notifications to patients are all part of that world. The other world, though, is really the ability to improve care delivery and optimize using the communications infrastructure in our world to enhance the model and the workflow. So what I would say is similar to what Anil said, is first things first is understand your operational. So we take a platform approach as well. So it's important. We have a lot of opportunities to design capabilities from a communications infrastructure standpoint to whatever model you want to build and how you want to service your care model. So the big thing is to understand that care model, not only now, but in the future, because as this technology learns, where you apply the critical instances of AI, whether it's agentic AI, for example, or integrated generative AI, is going to be important in the overall IT infrastructure for a provider or clinic or operational model. So, for example, as you think about in our world, many cases things have been centralized in EMRs in healthcare for a long time for obvious reasons, and it's really become the ERP systems of all large-scale clinics and hospitals. But now, as you are allowed to bring intelligence maybe into the communications infrastructure, strategically, how do you best service your patients? And where do you drive workflows and activity in AI in that type of model? So you can make some really, there's tactical issues on productivity we're seeing that are early adopters and you can take on quickly. But strategically, AI gives you a chance to think through the whole domain of where you apply intelligence, how your care model is going to evolve over multiple years, and where you want to kind of get ahead of that curve, to the point being made by Neil that getting a governance committee with a broad set of stakeholders to really understand the evolution of care, because you really want to just point your AI to where the where the ball's going to land, not necessarily where it is right now. So those are things that I think are important to think about as AI at a broad set. To the specific question on early adopters, a lot of the embedded players and ecosystem players provide technology embedded in their functional areas, and I think the important thing we've always said for years, even prior to Ring, is that look to your partners to see what their technology strategy is, but at the same time have some focus on innovation from the marketplace, because we're seeing where many of the, as was mentioned, many of the AI experiments may fail because of that's what happens in an innovative type of structure. Some of those are really incredible leaps in technology and value. And if you can adopt those technologies into an infrastructure play, you get real advantages in kind of driving a care model and differentiation in the market. So there's a number of things to kind of consider in that sense. But I think AI is opening up a real strategic challenge to companies to think through how their long-term models are going to work and where do you want to apply that next generation of AI.
Great.
Yeah,
Good insight.
Greg, something that John said just kind of reminded me of something that I want to make sure that we sort of double click on. I do think that there's an opportunity strategically thinking through what is the role of the electronic health record and what is the role of the adjacent tooling, and ensuring that we're not just relegating to an environment where the EHR is doing everything for us. And I think there are lots of AI solutions that can be adjacent to the EHR, but a couple things. It still needs to revolve around the pristine quality of the data required for AI, but also the workflow integration. Most clinicians, most individuals in general don't want to have to log into multiple systems or use different products. So I think John is absolutely right. that ecosystem is a key component. But I do want to make sure we are thinking beyond the EHR when we think about a AI strategy for health systems. I just wanted to emphasize that.
It's a great point. I mean, from our research, those that are more mature in their data and analytics journey are generally utilizing a solution outside of the EHR as a data aggregation and analytics platform. So I think that is important, that while the EHR is critical, as you mentioned, to the workflow, there's still data manipulation and ability to build analytics that go beyond what EHRs are generally capable for or used for. So that's an important aspect for organizations to have a strategy towards. Nitin, I don't know if you have any other perspectives. I know you gave us a lot in the intro here, but anything you wanted to add before we move on?
I think I'd just like to emphasize again that what John and Anil said, it's about the platform approach, and late adopters really have to think through the platform strategy and not just a bolt-on solution strategy right now, because early adopters really tried that bolt-on approach, and now they have reached a stage where some platforms are available, or platform strategy can be directly integrated into the late adopters tech stack. So that gives them a head start, that there are certain solutions which are already proven, and how do you adopt those into your existing workflows to really get that benefit of AI. And the other part is, and to which everyone has here already alluded to, is that EHR, although will remain a central focus, but there is a need to think outside of EHR, and how can we have a better user experience while still catering to the overall dynamics that EHR provide, or the comfort that EHR provides to most of the providers. So how can we still have that, as well as get a solution or a user experience or a user interface that has even more capabilities or broader data processing or data integration capabilities?
Okay, that's great points. Good. I think that's been it's a good start to the discussion, some good insights for our audience to think about as they bring these technologies into their organization. Let's move on to the next topic. Nitin, I'll hand it back to you.
Yeah, and this slide slightly hinges with what we were already discussing about the early adopters and the late adopters, but this time we would like to focus it more from a geographical standpoint. So the US has traditionally been the most active early adopters, has had most of the smart hospitals, or the environment, a favorable environment for even the startups to really push their technology into the market, test it, grow it, and then really enhance the overall efficiencies of the healthcare system. Meanwhile, outside of the US, we still see that AI is catching up. There are lots of learning that are being transferred from US to the organizations outside the US, and they are taking up those learnings to actively employ this technology and really ensure that they're not making the same, I would say, not the mistakes, but the same challenges that the early adopters face, so they can minimize those, and then really start quickly gaining the overall return from their investment. Some of the challenges that have really impacted regions outside the US is more around the centralized payer procurement process, wherein there's a tender process that happens, and that leads to a delay in selection and implementation of technology, and also creates a delay in how newer upgrades are added to what was first procured. The second thing that especially the most of the Middle East or APAC regions face is around the technology and infrastructure, the data centralization, or the interoperable capabilities that are already existing in their platform or in their system. There's those regions, or the hospitals providers in those regions, are still catching up in terms of having that baseline technology in place really to optimize their data centralization processes or their interoperability initiative to really have that next step, or take that next step of implementing AI on top of those solutions to garner benefit from it. And this difference is then visible on the type of use cases that are being considered. So in the US, documentation, especially the real-time NLP and transcription, is considered now more of the mature use cases of AI, especially the conversational AI. And adding the generative AI component, it has become sort of more solidified as a mature use case. It's the growing aspect, which is around clinical triage or asynchronous virtual care or claims management, that are now gaining traction in the US and are moving ahead in the maturity curve. Outside the US, there's still high priority given to the documentation use cases. Countries are still looking at how they can work with the AI scribes to really enhance or ease the burden or the pajama time for their providers. So that is how we see that the use cases which are first being tested in the US, then they are slowly being transferred to regions outside the US. And a trend that we do expect will continue for some coming year with this technology and will really impact on how the overall market shapes up. Because if there's a new AI model that comes in the next 2 to 3 years, it will impact on how the regions outside the US will have to quickly monitor or re-strategize on their adoption strategy. And considering their longer procurement cycles, that might impact on when they really get access to it. To you, Greg, question.
Great. Thanks for that intro. As you mentioned, in any of the health tech fields, we see the US often as the leading early adopters, way ahead in many cases of other areas of the world. The pace of technology innovation and implementation really has driven the AI market in the US. Outside the US, we see some different priorities. The ecosystem's different, the drivers are different, but there's still a lot of interest. We see early adopters clearly in every country, even those where the baseline digital infrastructure lags in hospitals in the majority of that market. So the questions are around, what do vendors need to pay attention to as they try to help their customers outside the US take advantage of AI to improve financial administration, operational workflows? How can vendors ensure that their solutions are viable, not just here in the US, but also in other parts of the world? And does a single payer environment impact the integration of AI as an enterprise strategy in other places outside the US? Where, here we have the fragmented market, which is a challenge for us in some ways, but also can be a driver in some cases of early adoption across different entities within the system. So what can vendors do to try to make sure their products are going to be accepted and successful outside the US? John, why don't you take this one first?
Sure.
You
Thanks,
guys are a
Greg.
global company, so you had experience across many industries outside the US.
Yeah, it's a challenge. Obviously, I think it was mentioned earlier by Anil that you have to be a good data company to be a good AI company, and the data structure and centralization issues that were mentioned by Nitin are challenges. So even if you have, for example, embedded AI in tools, so what RingCentral has done in our approach, one of the things I'd recommend would be that one of the good things about being maybe a later adopter is that we filter out in the US a lot of the maybe .AIs that will go away. So you can save your swings on misses in the AI market. However, and as technology gets embedded into kind of core applications, whether it's ERP systems, whether it's EMR systems, whether it's other tools like communication systems or tools that Anil has talked about, taking those over to other regions still has a data challenge because you have to make sure in many cases that all the information is stored locally, all of it is following the local compliance laws. And so you need to basically look at that. So as we look at the evolution of our services into Europe and Australia, which happens to be very advanced, we see the Australian region very advanced and throughout the globe. Obviously that stuff is paramount because as an infrastructure that basically retains, in some cases, the PHI, and more so with AI, the PHI is within that information. You need to make sure that the data storage standards and the way you keep and localize data is very important. So for vendors, it's an infrastructure play that has to be thought through strategically, looking at the guidance and compliance issues that are there that drive data standards that have been around for a while, but particularly with AI, because if it's not protected, obviously there's some real challenges, and I think we're going to see future legislation that basically puts limits on that by design. So it's an interesting expectation going forward. So on the tough side, that's where I think the challenges lie, and getting the automation of the data in the current model and then being able to apply AI to it smartly makes it a big challenge. On the flip side, though, what's interesting always with the single payer system is that because of the economic model of a centralized system, as care evolves in new ways, and this is where it gets really interesting, when we look at the incentives to drive proactive care and wellness in new ways, and in our world, use communications to promote an intimacy with a practice or a provider group so that you're engaging a more informed patient and the patient is following a protocol that's going to help them take personal responsibility in their health. We believe communications, AI tools are really a rich area to mine. And because the long-term benefits in a single payer are economically viable in their best interest instead of maybe a fragmented US market, you have real incentive to look at a new model that AI brings. And I think that's where I'd expect to see maybe some of the European markets bring out some very interesting workflows and opportunities to leverage AI in terms of driving next generation of care within their single payer system because of the advantage they have in owning end-to-end that life of a patient and not more of a fragmented economic or profitability model. So those are the things I tend to think about as I look at those two dimensions going forward. I think in general, though, you're going to see a very similar adoption curve outside the US with a fewer number of options that are screened out by US competition, but that are embedded into platforms that I think both of us are developing for the future that we want to scale globally. So that's where that's my initial thoughts on that.
Great, thank you. Very good. Thinking the platform approach as we go forward. Anil, anything you wanted to add to that?
Sure. I agree with everything John said. I'll start with something he said near the end around the single payer. I would also say that the single payer systems tend also to be those that are under heavy legacy costs. There's a reckoning that's going to be happening in terms of how they reduce some of those legacy healthcare costs for their population, and I think AI has a role to impact that. But going back to some of the ways that we might approach it, this is not theoretical or hypothetical for Innovaccer. We're not as global as John is right now, but that's what our goals are. And when we think about that, it really starts with this ability for us to make sure that we are forming local partnerships and that we are enabling with local talent. We need to understand that culture, the climate. We need to understand who the system integrators are in the area that are trusted and respected in order to make sure that the implementations go as smoothly as the initial sales. The other thing I would say is, again, from a clinical lens, we have to make sure we are localizing for the clinical, regulatory, and the language needs. We know that there are different drug databases that are being used in other countries. We got to make sure that we don't call something Tylenol in another country where it's not called that. Paracetamol versus acetaminophen, for example.
Mm-hmm.
These are little things that make a big difference when it comes to trust and transparency around how we're going to localize for that market. Even language, something as trivial as the way we refer to certain things in the clinical settings, those all need to be localized. And they need to be localized, again, with partnerships locally, because at the end of the day, it also needs to be maintained over time. And so we don't want to burden the R&D process. It's really around sort of joining forces and creating a glide path for vendors to be able to very quickly globalize, localize their solutions. And then, John already alluded to the infrastructure, so I won't repeat some of that, but we can't assume that everyone in the global markets are going to have the same ROI equations that we do. If I'm building, as we have at Innovaccer, a provider co-pilot where we are helping the provider summarize the chart, document the encounter through ambient, and then produce some technology to help with the chart wrap up, we have to think about in other countries where labor may not be as expensive, where human scribes may be competing with these digital scribes. So the ROI equations also need to be changed, and therefore some of the pricing that vendors might be approaching might also need to change. And I'll just my final thought on this, and John alluded to it earlier, is the data privacy is a big deal in other countries that can also sort of impact the way that the vendors start looking at their products. So whether it's HIPAA in the US, GDPR in Europe, or PDPA in Asia and other markets, we really need to understand what does that mean, because that will impact the way that the single payer governments start looking at procurement as well. They want to be assured that they're not going to get into a jam because they weren't thinking through around the ownership and privacy of data, but also importantly, what is their constituents, the citizens of that country, going to think in terms of how their healthcare systems are adopting various technologies that may be putting their privacy at risk. And that is a much bigger deal in some other countries than it has been in the US.
Well, fair enough.
Yep.
Okay.
I think
Nitin,
just to
anything you wanted to add?
Yeah, just to reemphasize, and we have seen this problem, and from every vendor that, especially around the pricing front, like technology that is priced in the US cannot be priced in a similar way in the other geographies. So essentially, the entire redo of the cost calculation, the ROI for both the vendor as well as for the end user, really impacts on how the technologies are really transferred from inside the US to outside the systems. The other aspect is, and I think that is equally important to what Anil said, is the forming of the local ecosystems or local partnerships and really tapping into those to have that early reach or early use cases being adopted within the even provider of pair organizations, and capitalizing on those existing resources to ensure that you get that penetration that is required to enter into that market. The last point that I would add is vendors would really need to appreciate or look at how the governments are thinking on this, and if they are already planning or something on these lines, how can they help uh, the government form those policies or those initiatives. Like in the Middle East, especially the GCC nations have set up their smart hospital policies for 2035 or 2040. And it is in these that they would like to really enhance or inculcate AI and make it especially a medical tourism hub or the top-notch medical facilities in the eastern side of the world. So how can vendors really play an active role in shaping up those policies or those decisions and uh, building that in required infrastructure from the get-go so that everything is sync, integrated, and interoperable and AI-driven from the start.
Okay, great. Good point. Let's go to the last discussion point. And before we jump into that area, just remind people, if you would like to submit a question, please put it into the chat box and or the Q&A section on the Zoom link. And we will take those questions as we get to the end of the session. So please feel free to interject your questions or let us know if you want to ask a question. All right, Nitin, back to you to talk a little bit about what we've touched on in terms of responsible AI and areas that we need to focus on in order to make sure we're aligned going forward.
Absolutely. And I think no discussion of AI is complete about having a discussion on the responsible side of things and or the responsible elements. It is what we say is the elephant in the room for any of these AI discussions and really require a heads-on approach to tackling this challenge. The responsible AI principles or elements have mostly different right now for different organizations. There's not a set standard that everyone can follow or everyone should follow to really ensure that we have these defined principles or defined approach to generating or building up a responsible AI strategy. That is one area where everyone needs to target, and even the government or the stakeholders across the broader industry need to come together to really define what can we say is a responsible AI strategy. The other element which comes up with the innovation in AI is with the agentic AI, we are seeing more of the autonomous processes now. So how does the responsible principle, especially the human element, changes? We are having agents perform our task. So where do we have the human in the loop concept, and how will that really impact the overall flow or adoption of the technology, and where does the human sit to really monitor this technology adoption? The second aspect of what you see on the other side is the evolving pace of AI. So in the last 3 years, we have seen the discussion shift in the healthcare sector from conversational AI to generative AI to the agentic AI now. And even within the agentic AI space, we are seeing some broader sense of adoption in terms of started off with the specialized agents for a specific task, and we are now moving to orchestrator agents, which can do our work in the clinical or in the operational fields. And ultimately, we want to reach to a point where we have more of an agent-to-agent interaction, which can increase the efficiency of a process, but as well as improve the stakeholders' life who are really managing those operations, or the administrators who are actually working on those tasks. And one such area which I think most of us would really have been trying to target or look at the possible implementation of an agent-to-agent interaction is in the prior authorization stage, where we can expect this technology to really pick pace and enable automatic submission of documents and then an automatic reply being generated from the payer side, which can be dealt with an agent on the provider side. So having a minimum interaction between the humans, but agents doing most of the work. The next bit is, or where the next step for these agents will be on the ambient side, which is more on the always listening and predictive agents, and how they can really enhance or start with a query or provide solutions while they're listening to an interaction instead of a user activating these through a query. So how can we do that is probably the next step that we see the technology, but given the pace, it can be near or far, and we can have another model or two in the next 2 to 3 years. But how will these growth, the sudden burst in newer models or newer agents really impact the responsible AI principles is something that we have to consider side by side as this technology goes ahead. Over to you, Craig.
Thank you. So I think we all expect, and those investing in these solutions of AI-based solutions also expect that the gains from these solutions are going to increase exponentially as we get deeper and deeper into workflows and enterprise strategy. We see newer models that are enabling autonomous processes. We've talked a lot about agentic AI here in 2025 that significantly ease the burden for end users. But there's still backlash and concerns, as we sort of hinted at earlier, from both researchers as well as clinical communities in terms of what the role of AI should be and what the role of the human in the loop is. Realistically, in some of the agentic AI processes, there is not a human in the loop. But in any clinical situation, I would expect that will still be the norm. How does this introduction of agentic AI start to change how organizations look at AI governance and building policies around AI? And as we move towards, again, agentic AI, so conversational agent AI, now agentic AI in 2025, where do you see AI heading next in the healthcare sector? It's been a pretty rapid shift. Where do you see it going forward? So let's talk a little bit about the agentic side and maybe what comes after that. Anil, maybe you can start.
Yeah, sure, Greg. I think this is a very, very important topic. So I alluded to the governance committees, governance frameworks earlier. And of course, these will need to change when we start thinking about taking the human out of the loop in some of these agents. And then to Nitin's point, as you start thinking about agent to agent, even in the case of prior auth, which is something that we at Innovaser are working on, there needs to be a very, very good understanding of the risk classification. What I mean by that is, what is the risk of getting it wrong? What are we trying to do here? And even if something is administrative as prior auth, what does it really mean? And sometimes that would mean that these organizations might have to change some of their policies. They might also have to really look at their scope of practice. Who in the past was working on prior auth? And are we asking a system to do something that a credentialed individual needed to do in the past? These are all questions that need to happen and that need to be part of a governance framework around AI. We also need to go from having a very static AI governance framework to having something that's a little bit more dynamic, because these agents will learn over time. They are going to change in their ability to respond. And we've all, for example, had an experience where we have had an ambient agent who might be listening to us. Pick whichever agent you want that we use in our consumer lives every single day. And we've had some very, very significant false positives. Maybe it's an innocuous, maybe it's making a recommendation to watch a show that we're like, what in the world was it thinking? Of course, we wouldn't want to watch that show, all the way to automatically asking a question because it thinks it was triggered by some sort of response. I mean, these are simple examples, but in healthcare, they can have dramatic impacts if we get it wrong. So there needs to be some level of risk classification. There needs to be some understanding of the scope of practice. Are we asking the agents to do more than what human beings were allowed to do in the past? And then making sure we're going from a static governance process to a dynamic one that is is reviewed regularly because these agents are learning over time. I think the other important piece is making sure on the technology side that we are very, very clear from an AI ops or an ML ops. What are we seeing in terms of bias detection, in terms of machine learning algorithms? Are they working as intended? Because we need to be keeping a close eye after these things are in use, whether there are any unintended consequences, so that those little hiccups that we experience in our consumer lives every day don't become malpractice issues in the healthcare setting down the road. You also asked another question around, where is AI sort of leading us to? And I think we just have to make sure we all are on the same page. You said something very interesting, Greg. You said that of course, in clinical use cases, there will always be a human in the loop. Well, I would venture to bet that there are vendors out there that are looking at clinical use cases that are trying to figure out where can we take the human out of the loop. And I think as we start thinking about the shortage of physicians, the shortage of nurses, there will be situations, very low value work that myself, for example, I'm an internal medicine doc when I used to practice. There's low value work that, frankly, I would love for it to be replaced by AI. So I think that bar will keep moving as a society from a regulatory point of view, a credentialing point of view, and we will start to get more and more autonomous on things that today we are expecting only to be assisted. We will see them much more autonomous in the future. And for that to happen, it goes back to the earlier comment, there needs to be very tight governance because we could get it wrong. I also think that you kind of alluded to this earlier around agent to agent. There's going to be a world in which these agents, which are digital workers, are going to be collaborating with each other. They are going to be evaluated just like human workers are. And I think the future is going to be digital workers working with other digital workers being supervised, perhaps by humans, but most likely by other digital workers across companies, across ecosystems, across EHR vendors, across clouds, et cetera, et cetera. So it's going to be a very exciting time where we're heading next in terms of AI. And I think for that goes back to what John and I were both saying earlier about a platform approach. You got to have a platform because it's going to be a mess if we don't have that. Let me pause there.
Great, really good insights, good thoughts. John, what would you add to that?
Well, a lot to cover in those areas. Going back to kind of the basics of the core that Nitin started with. We see everything being driven. Obviously, when we look at all these elements, we think they're all kind of moving in parallel to some degree rather than an evolution. So, conversational AI and IVAs. We just launched our AI receptionist tool. So that whole construct of how you interface at the first level with the population or the patients that you work with is going to take its own journey, right? And there's still some issues about whether or not you can actually deliver care through things like translation programs, which in conversational AI, we have partners that do over hundreds of languages innately. When someone starts speaking a foreign language, it understands that. It can translate back and forth to English. So while it's huge for access for care, it helps out getting the best doctors to everybody in the country or in the world. There's still concerns about that. So right now we're gonna be watching that translation programs and seeing when they will get to a level of comfort where we could do a real kind of use that type of agent or support going forward. On the generative AI side as well, trying to think about when we move information or do agent assist and other products that we build, all of it we believe is centrally tied to the core platform infrastructure in place today. So for us, it's about voice and getting to an agent or getting to an administrator. So all the tools that we use, we want to integrate into and contextually bring that history into an agent experience. Because as AI goes through its motions, we want to make sure that in the end, when the agent gets stuck, or if there's a challenge, or if the user or the patient doesn't like what they're hearing, we can get back to an agent with context, with information that flow directly into letting the human element help. That's all a big part of it, right? So as we look at building contact center solutions, automating scheduling, automating all these activities in terms of the empirical needs of our patient base, we want to make sure it's tied to the core infrastructure that's there and tied to the core users that are there. Similar with stuff like start to get agentic AI and others, we can capture everything said in a conversation. We can start to act on all that. But I believe, and we're looking at how do we start to put metered pieces in there where we get the human to interdict. So you do the optimization through AI for the discussion. You capture and optimize the call. You pull out the key elements, and you have recommendations that are promoted. But then you pause that, and you have a step where the actual doctor or care provider reviews that before you might enter it, for example, in a system of record. And that's the kind of platform infrastructure. Integrations and APIs are all a key part of this, because you want to keep tying all this activity that's happening, maybe with agents remotely, into concise decisions or activities or information that's material, and get that back to the systems of record that drive that material. So that's where I see a lot happening. In agents and activity will be happening remotely through dialogue, communications, and activities in our world. But then as we consolidate it, understand it, then validate it, we then move it into systems of record to move the entire care model forward for that patient or that group. So I think it's a combination of the human element as a trainer of the tools. I think what Anil mentioned earlier, where you have this quarterly review of how's our AI doing? Does it really reflect? I mean, if you capture all your material, a lot of our tools will learn from all the written material in a company, and you might have disconnects between how you've actually practiced. If you have a call history with patients versus what my mission is on my platform, you might have a difference because you're not really responding to what your mission is for empathy or other things. And so it'll be interesting to really review that on a regular basis, because all these discrete pieces come together in AI in a unique way, and being very attentive to that model going forward is going to be critical as you pull all these different agents and activities around AI together. So for us, it's really, again, thinking through as we evolve from here, where humans are doing a lot, we certainly want to automate activities, as was mentioned by Neil, that many people don't want to do, but you want to connect it as a kind of an augmentation to the human activity as kind of the first phase. When the confidence gets to a point where we have all of the outlying factors under control, for example, a schedule, for example, where all the elements are somewhat fixed, I might move that to an all-agent experience, and I don't need to have someone check that per se before it goes into system of record. But when it comes to anything that has to do, for example, with clinical, diagnostic, or conversations about care and patient, that's going to be a long time, I think, before we get to a point where we remove the humans from that. I think augmentation is going to be a big part of that in any of these areas going forward. You're going to need to connect at some point in time to the trusted care provider by design at some point in time.
Okay, good insights. Thank you.
Yeah, it will always be an interesting discussion on how we move forward when it comes to responsibility and having the technology. But another important element to consider is, as we try to integrate this and work towards that digital workforce, so how can we really ensure that the doctors or future doctors are already ingrained in this concept, and how can a solution provider really participate in having this technology being introduced early to these incoming professionals, so that they don't face that same sort of resistance going in. So is there a way that we can introduce these technologies early and help them acclimatize better to the emerging technology, rather than first moving into the workspace and then looking at these? So that will give, I think, time as well as an opportunity for everyone to really work on these AI models and ensure that they are more reliable, more sustainable, and can really serve the longer term purpose across the value chain, and not just for a specific use case in the provider journey.
Let's build off of that just a moment as we close off, so we only have maybe a minute each for an answer. But you guys are, working from the vendor side, and you work with a lot of different customers. How would you advise end users to, in their partnerships with AI vendors, to support their own digital and data transformation? How can they best leverage their vendor relationships, or best manage them to, get the most gain in their own data transformation going forward? Maybe,
Yeah, I mean, I would.
John.
No.
Okay, go ahead, Anil. That's fine.
Go ahead, Neil.
I was just gonna say, I think it kind of putting everything together that we already said. I'll be very brief. I think is really to shift the mentality from a vendor selection to a strategic partnership, a partnership that is going to bring in a platform approach, align it to the organizational strategy, making sure that the core components are covered, phase it out, put a timeline together, make sure that you have a digitally um, uh, sort of there's a knowledge base around what has to happen digitally from a data point of view before you can get to AI. And then with the strategic partnership, allow for that collaboration and customization to happen. So it's not a one size fits all from the vendor. And then the final thing that I would just emphasize is that at the end of the day, all healthcare is local. So having that healthcare organization work with the vendor to make sure what elements from a regulatory point of view, from a localization point of view need to happen, explainability, transparency, and trust. All those things require a strategic partnership and not just buying something off the shelf as a point solution.
Couldn't agree more with Anil on this one. I think we're in complete sync here. One of the things we're doing at Ring Central is reinvesting in what we call executive business reviews on a quarterly basis with all our clients, our customer service managers, our technical account managers, the operators of services for us are no longer just clerks checking boxes or making sure the number of circuits, the number of calls, and call volume is what's managed, right? As we move to bringing AI and the content of conversation into a material part of care delivery, we need to understand what this practice, what this hospital system, what this clinic wants to do with their patients. How do they want to treat them going forward? Where do they feel they can promote maybe automation in a way that's safely and comfortably handled by their patients? And where might it be a place, for example, behavioral health, where we're going to be a little skittish about that up front? So it's areas like that that make it critical that even with vendors in what used to be like communications, a utility, are now becoming people you have to invest and talk to, spread and bring not only the IT team, but bring the operators, the chief nurse, the chief medical officer, the operations people into the dialogues, as was mentioned earlier, good governance, to allow us to really think through where we can most productively leverage the AI models that are coming so fast and furious.
Right. And I think it's really important for the end users to consider vendors as their partners, like Anil said, and as well as their strategic advisors, so that they are more close with this evolving technology and they can really help set up those governance boundaries or the councils and the script that is required to really ensure that what you are putting your money in is what is ethically and responsibly suited for the organizational need.
Okay, good way to end this up. We're right at the top of the hour, so I think we will close here. If anybody in the audience has a follow-up question or excuse me, guys, follow-up question or comment, please feel free to send it to us and we will address it offline. I want to thank John and Anil for joining us, along with Nitin for putting together this discussion and offering some great insights to both the vendor, end user, and other ecosystem participants as we move this forward. It's going to move quickly. We better be ready. Take some of the recommendations here to heart and start moving them forward within your organization, because you are going to have to address the questions that we raised today, and we've given some good opportunity to discuss how you can do that successfully from the experience of our panelists. So thank you much for contributing that experience to this discussion, and we look forward to future interactions. Thanks, everyone.